Welcome to UMCC Medical Consultant Connector, where your health matters. We've all been there. You're trying to sleep, but there's a symphony happening next to you. A symphony of snores, loud, obnoxious snores that could rival a chainsaw on a Tuesday morning. It's like a relentless, grating noise that pierces through the silence of the night, making it impossible to drift off into dreamland. It's enough to make you question your relationship choices, your sanity, maybe even the laws of physics. How can one person produce such a cacophony? You might find yourself wondering if there's a hidden orchestra in your bedroom. But what if those snores are more than just a nighttime nuisance? What if they're a cry for help from your body? A signal that something isn't quite right? What if they're a sign of something sinister? Something lurking beneath the surface, waiting to disrupt your peaceful slumber and wreak havoc on your health? Something that lurks in the shadows of your sleep, silently wreaking havoc on your health. Sleep apnea, a condition that causes your breathing to repeatedly stop and start during sleep, could be the culprit. Buckle up, Buttercup, because we're about to dive deep into the fascinating and slightly terrifying world of sleep apnea. We'll explore its causes, its effects, and what you can do to reclaim your nights and your health. So stay tuned and get ready to uncover the mysteries of the nightly symphony of snorers. Sleep apnea is like the monster under your bed, except it's in your bed, and it's stealing your breath. Literally. This sleep disorder is characterized by pauses in breathing or shallow breaths while you sleep. These pauses, called apneas, can last a few seconds to a whole minute. Imagine someone hitting the pause button on your breathing while you're trying to catch those zzz. Not exactly a recipe for a restful night, is it? So, what summons this snoring monster? What brings this nocturnal nuisance into our lives, disrupting our peaceful slumber and turning our nights into a symphony of snores? Well, it turns out several culprits could be responsible for inviting sleep apnea to the slumber party. It's not just one thing, it's a combination of factors that can turn your sweet dreams into a restless night. Excess weight, carrying around extra pounds, it's like trying to sleep with a bag of potatoes on your chest, not exactly conducive to clear airways. The extra tissue in the throat can block the airway, making it difficult to breathe. This is especially true if the weight is concentrated around the neck area. Getting older has its perks, but unfortunately so does sleep apnea. It's like your body's way of saying, hey, remember sleeping? Yeah, it's going to get weird. As we age, the muscles in our throat can become weaker, making it easier for the airway to collapse during sleep. Genetics, thanks Mom and Dad. Sometimes sleep apnea is inherited, like that weird lamp your aunt gave you. You don't want it, but here it is. If your family has a history of sleep apnea, you might be more likely to develop it too. It's like a genetic hand-me-down that no one asked for. Nasal congestion or a deviated septum can also play a role. If you have trouble breathing through your nose, you're more likely to breathe through your mouth, which can increase the risk of airway obstruction. Large tonsils or adenoids can also be a factor, especially in children. These can block the airway and make it difficult to breathe during sleep. Lifestyle choices like smoking and drinking alcohol can also contribute. Smoking can inflame the upper airway while alcohol relaxes the muscles in the throat, both of which can lead to sleep apnea. So if you find yourself battling this nighttime monster, it might be time to look at these factors and see what changes can be made. Consulting with a healthcare professional can also provide guidance and potential treatments to help you reclaim your restful nights. How do you know if the sleep apnea monster has taken up residence in your bedroom? It's not just about a bad night's sleep. It's about a series of symptoms that can seriously affect your quality of life. Look out for these telltale signs. Snoring, like a chainsaw on karaoke night. We're not talking about cute little snores here. We're talking about the kind of snoring that could be used as a sound effect in a horror movie. We're talking about earth-shattering, window-rattling snores that could wake the dead, or at least your neighbors. Daytime sleepiness. Feeling exhausted even after a full night's sleep? It's not just about feeling a little tired. It's about struggling to keep your eyes open during important meetings or while driving. Sleep apnea might be the culprit, robbing you of those precious and leaving you feeling like you could sleep through a hurricane. Imagine waking up and feeling like you haven't slept at all. Waking up with a pounding headache. It's not just a minor inconvenience. It's a sign that your brain is struggling to get enough oxygen during the night. It's like your brain is trying to escape your skull after a night of oxygen deprivation. These headaches can be debilitating and make it hard to start your day on the right foot. If you notice any of these symptoms, it's crucial to consult a healthcare professional. Sleep apnea is more than just a nuisance. It's a serious condition that can have long-term health implications if left untreated. UMCC, your ultimate medical consultant connector. Kindly subscribe, like and share.